Thank you for joining us today. I'm Charity Menefee, the Director of Communicable and Environmental Disease and Emergency Preparedness at the Knox County Health Department. Today, our moment of gratitude is dedicated to those organizations who have donated supplies to us during this pandemic. The list is too long to mention everyone by name, but we are posting thank yous to our social media pages, so please acknowledge those folks there. We truly appreciate all they're doing. As we've discussed several times, securing supplies, whether we purchase them or we get them from our state or federal partners, has been an ongoing challenge, not just for us, but for everybody across the nation. So we're especially grateful to local individuals and organizations for your support. Speaking of supplies, we want to talk a little bit about testing. Testing is a valuable tool. It's one of our tools in our toolbox in identifying cases and helping us find others who have been exposed. We're hearing anecdotal reports that some folks are getting tested multiple times and not at the advice of their healthcare provider. While we continue to expand testing capacity and we're encouraging local healthcare providers to do the same, there are limited supplies. So we encourage you, if you've gotten a test, please wait for those test results to come back. If something's changed, consult your healthcare provider from that, but please don't get multiple tests while you're waiting on results, or if you're worried and there's been no additional exposures or anything like that, you don't need to keep getting tested. We want to conserve those supplies. On the flip side, we're also hearing reports that folks want to get tested once they assume, and to use that to assume they're not at risk of developing COVID-19. From that point on. We really want to make sure everybody knows that means you were negative at the time of that test. That's it. So we still want you practicing all of the things we've been talking about. It doesn't prevent you from getting COVID-19 in the future. So doing the social distancing, staying 6 feet apart from others, wearing a mask, not going out unless you have to, all the things we've been talking about, we still want you to do even if you have received a negative test. It is important that we use supplies we have as strategically as possible. So let's talk about who needs to be tested and when. We would like to prioritize testing with people with COVID symptoms. And those are really people that have cough, fever, shortness of breath. They may have body aches, headaches, sore throat. They may have loss of taste or smell. Those folks. We also want to talk about people who have been close contacts to confirmed cases of COVID-19 and healthcare workers. Those are the really our strategic priorities for testing at this time. Since we know some people who have COVID-19 and won't show symptoms, we have made testing available to those people, but we still truly want to prioritize the other groups as much as we can to conserve our supplies. Again, remember that testing is a snapshot in time. It tells us if you were positive on the day you were tested. Therefore, we want people to be tested when it's most likely to yield accurate results. The virus can take a few days for the test to show up. So we recommend contacts get tested approximately 5 to 7 days after an exposure, just to be on the safe side. When we refer to what an exposure, what is that? We define that as prolonged contact with a confirmed case, being less than 6 feet for more than 10 minutes from a person. That's another way that you can look at that. An exposure to a case is not just walking by somebody in a grocery store or stopping by and staying 6 feet away from somebody and saying hello. That does not constitute as an exposure. While we're thrilled to have been able to test more than or almost 1,000 people over the past month, with over 600 the past 2 days, we know that changes in our testing schedule has been frustrating to some, and we do apologize for that. It's an indicator of how fluid our supply situation is during this extraordinary public health event. Sometimes what we're expecting to get in has been diverted somewhere else, or there's logistical challenges in getting it to us. There's a lot of things that come into play there that make this challenging. So we want to address those as soon as we can and make sure that we make changes to be able to meet the demand and those people that need to be tested as soon as possible. So there will be probably some changes that come as we get more supplies. We can open things back up more. As they decrease again, we may have to pull it back in a little bit. But we're going to be fluid with that, and we hope that you understand that as we move forward. We are still taking appointments for tomorrow and Friday. Additionally, we are offering another testing event this Saturday. We have been concerned about the lack of testing access for certain parts of our community. And so in order to make testing more accessible for people in those areas, we looked at our data and picked the zip code where the data shows the least amount of tests were performed, and that was 37915 zip code. So with that said, our testing event on Saturday will be at the Coliseum, which is at 500 Howard Baker Jr. Avenue from 10 a.m. to 2 p.m. And that is in that zip code. The public can drive through or walk up to get tested, and appointments are not required for this event. So we're very happy that we can provide that to this community. We also want to reiterate that we are not the only source of testing. We encourage the public to reach out to their primary care provider first. As we've been saying, a full health assessment is ideal in this situation. There are also multiple urgent care and walk-in clinics providing testing, and we have those listed on our website, which we've walked through here before, and want you to use that as much as you can. Or you can call, the public can call us to access the list of providers by calling our public information line at 215-5555. Now we'll move on to our local situation. We have 199 confirmed cases of COVID-19 in Knox County. 166 of those have recovered. 28 have been hospitalized at some point in their illness. And we're pleased to report that we have no additional deaths due to COVID-19 complications at this time in Knox County. We'll now open it up for questions.
Please go ahead and submit your questions into the chat feature. From WBIR on testing supplies, Governor Lee / Dr. Piercy spoke yesterday specifically about getting supplies to Knox County. Mm-hmm. How many and what type of supplies?
So we are getting testing supplies to help support our event on Saturday, and don't have the firm number for that at this time, but it will be a large amount to accommodate the large volume we expect for that event on Saturday. So that's testing supplies, PPE to support that. Very happy and grateful to the state for helping to get us where we can do this event Saturday.
A follow-up question here was, how will that impact testing capacity? Does it mean the county will open it back up to testing for whomever, or will appointments still be needed?
Well, I think right now appointments are going to still be needed, and we will update you if things change as we move forward. It does allow us to extend our appointments for several more days with that capacity getting additional in from the state, but we'll be revisiting that if things change, but appointments will still stay at this point, other than Saturday.
From the Sentinel, what are the exact measures being used to guide reopening decisions? The benchmarks we made to the public, correct?
Yes, we are working on that. So those things will be with the task force that's working on how we're going to reopen the economy and move forward. We hope to have that information out as soon as possible, and we will do that, and measures will be explained. But I think Dr. Buchanan hit a lot of those. Our case counts, hospitalizations, we'll be looking at any new fatalities in the area. I think we'll also be looking at, COVID-like illness that she mentioned. So looking at kind of how we do our traditional flu surveillance for people that may not be getting tested or that are going to the doctor with certain symptoms. And we might look into, or we will be looking into what our contact situation is looking like. How many of those are testing positive? Are they in groups of people, or are they spread out throughout the community? All of those things will be together, put together to make a good picture and help make decisions moving forward.
Also from the Sentinel, what is the daily testing capacity of private labs in Knox County?
So the lab situation is a little bit difficult to explain, and so I'm going to do the best I can. So there's very few labs actually doing testing in Knox County. The labs are mostly national labs that are getting tests from across the country, which is why that's a really hard thing for us to nail down a number. I can say that we are seeing more tests coming in every day, and we're hearing about them. We're trying to get a good handle on what that looks like. We've talked about that previously as well, the challenges that come with getting negative test results. But we are seeing more and more testing every day. So we're seeing that it's improving, and we hope that that continues to do so.
Another question from the Sentinel. The health department ran 2 drive-through testing days where you saw approximately 400 people each day before shutting down due to supply issues. What is the daily testing capacity of the health department?
Well, again, that's where we get back to the fluid nature of how many supplies we have on hand. And so we did what you said. We tested a whole lot of people the past 2 days. Like, as I mentioned in our statement, we've tested nearly 1,000 people this month. But the testing capacity is really going to depend, and I can't give a hard number because it depends on what we have on hand each day. And that's, again, we're working very hard to secure more supplies coming in. So it's a very fluid situation. But that's why we're making appointments, to be able to accommodate what we have on hand.
From the Sentinel, what is your estimate of the baseline testing capacity you would need to safely reopen and establish contact tracing?
There's a lot of different, I had this question the other day, I think. There's a lot of different studies and data out there. I think that it's a big picture. That is one variable that needs to be looked at in this. And there's a lot of things that go along with that. So along with testing capacity, how many of those people are testing positive? How many of their contacts are testing positive? So there's a lot of different things that go into that. That's a really hard number to lay down. But as soon as we get some national and state consensus on that, we'll share it with you.
From WATE, any new guidance on the gradual reopening specific to restaurants, hair salons, et cetera?
The task force is working very hard on that, and they hope to have information out as soon as possible, and as soon as we can, we'll get it out to the public, but I don't have any specifics right now.
From WATE, a report is out today saying that the state is ordering masks for everyone in Tennessee. Can you confirm that? Have you had discussions about distributing those?
I can't confirm that. That's encouraging, though, so I would think that's a great question for the state to look to them to get that answer.
From WBIR, in the past, Dr. B has said increased testing is a crucial step in seeing the burden of disease, which helps decide if Knox County is ready to reopen. The county is obviously struggling with supplies to test in large numbers. Are you comfortable reopening given the testing difficulty?
Yeah, I think that where we are right now is we have to be realistic with what we have and using the measures that we have. And we are still seeing an increase in testing, period. And I think that's important to keep in mind. So while we aren't able to test at the level of testing everybody in the community every day, we do have increased testing, and that's good. And I think the thing that goes back to those metrics and measures is we have not seen a spike here in Knox County. So while we can't say that we've seen a decline in testing rates, I think that's really because we haven't seen a spike, and that's a good thing. And so we've been staying pretty steady. And that's one of the important measures to look at as these decisions are being made by our community leaders moving forward.
From the Sentinel, it sounds like local hospitals and the county health department is tracking people who have been tested by address/zip code. Can the county make that information available?
Yeah, can you elaborate on that question?
Yeah, Tyler, if you can elaborate on that question and submit it.
We do. I can answer the first part. We do track cases by address. And so that's how we track all reportable diseases. This is how we move forward and how we classify always with notifiable diseases. So that part is yes, but I wasn't quite getting the follow-up side.
All right. We'll come back to that one, Tyler, if you just want to put another question in the chat box. From WBIR, with supplies in such short supply, is it a concern that there may not be sufficient supplies to test all people, for example, a nursing home that experiences its first confirmed case?
Well, I think that's why you see what we've done, where we've pulled back from doing the wide open testing, is that we need to conserve supplies for when those incidents happen, when they're available. And so that's exactly what we're doing. So no, I think that we're trying to manage the balance of widely opening up testing versus having it for those specific scenarios when they're needed.
Tyler has, from his previous question, when he asked, can the county make that information available on zip codes and addresses for testing, he's asking if we can share that in a map feature like we do with confirmed cases.
Got it. Okay. So again, that's really challenging. That's where we're trying to get that, where we can make that available. So we don't have the full picture of what that day looks like. So we can see what we can see. We knew that is the zip code with the least amount of people tested, but that's not all the testing that's being done in the community, which is why we are holding back until we get a better picture of that number, because we don't want people to make assumptions and make decisions based on incomplete information. So we want to do the best that we can to have the most accurate data available to the public.
From the Compass, does the health department anticipate reviewing deaths of people who had COVID-19 symptoms but never got tested? If so, how will that happen? And when would the health department be able to release the results?
I think that's a great question and a discussion with the medical examiner's office. So we can follow up with that moving forward. But I think we totally do look for or plan to look into potential deaths as we move forward.
Another question from the Compass: who are the members of the local reopening task force?
As has been mentioned, there are folks from Knox County Health Department, both city and county government, and representation from the chamber.
From WATE, an organization is protesting the COVID-19 response in local and state jails. They want the health department to classify inmates as a high-risk group and release more inmates, among other changes. Does your department share their concerns? Is enough being done to address COVID-19 in jails?
I can't talk across the community. I try not to talk about other organizations and the work they're doing and speak for them, but I can say that the work that we're seeing done here in our local community, they have a fabulous plan in place. They are isolating folks that need to be isolated from the rest of the population. Their testing is needed. We talk to them frequently when there's questions or concerns, and I feel comfortable with the response that they've had at this time.
From WBIR, let's talk about a possible second wave of the virus. Do we have any indication of seasonality? Influenza spikes in the winter, for example. Is the Knox County Health Department at a point where it is planning for a second wave?
Well, I think that it's important to know that second waves can happen. That's something that happens with pandemics. As far as seasonality or when this will happen with this virus, I'm going to go back to that. This is new, and it's new for all of us, and we are learning and getting as much information as we can. So it's really hard to pinpoint when that might be, but there are usually waves with pandemic scenarios. And so we'll be paying very close attention to that moving forward and talking with our leadership if we are starting to see something like that, and other decisions need to be made based on a wave happening.
From WATE, is the health department's budget under strain due to COVID-19? Is additional funding available specific to your department?
So yeah, there's lots of costs that have been associated with this response, and there are a lot of people working on the pandemic. There's a lot of resources that are needed, and that does cause a strain to communities. There are some grant funds coming down, but we are also very grateful that the county themselves have stepped forward and made our response there possible at this point in time, and they continue to do that. And we believe that will continue to happen moving forward. We don't see any issues with our response to this pandemic due to budget situations.
From WBIR, is the health department concerned that Knoxville businesses will follow the state guidance over the county health departments?
Well, I think as Dr. Buchanan said yesterday, we are going to be working together as a community, and that we will be following the governor's time frame with his order moving forward. And we've seen our businesses have done a really good job here, and our community, our citizens have done a really good job here following the guidance and following the orders, which is why we can go back to say we haven't seen the spike that other larger communities have seen, and we're very proud of that. And so we hope that, and we look forward to people continuing to do that. That's what they do here, and I don't think there'll be a change moving forward.
From WATE, Medic Regional Blood Center is seeing its first convalescent plasma donor today. Do you have any information available on the efficacy of CCP in treating COVID-19?
I don't have the specifics on that. I think it's a really wonderful thing that Medic's doing, and it's exciting that they're doing that. But I think those questions should go to Medic. But I think it's a fabulous thing that they're moving forward with.
Any additional questions, please go ahead and submit them now. From WBIR, yesterday, Dr. Buchanan spoke of the 30+ people the department has working on contact tracing. Mm-hmm. What is the burden of contact tracing on the department?
I'll try to address that, and if I don't hit it, you can let us know. It's a lot. So we've expanded our team, but we're also in our continuity of operations plan, which means we're doing things a little bit differently here than what we normally do on a daily basis, which has allowed us to pull in more people to our team and expand everything that we do in emergency preparedness. We want to make sure that it's scalable. and so that we can continue to scale up if we need to. And that's the plan that we've been implementing and that we've been building on, and we'll continue to do that as needed. So other team members may come in to help us, and we have a way to train them and get them ready to go and move forward so we can expand as needed.
Follow-up question there was, she mentioned possibly pulling in some furloughed Knox County employees to work on that.
Oh.
How likely is that scenario?
Oh, I mean, I think that that's a pretty likely scenario if as our cases grow, as we move through the next few weeks and months, we might need additional help, and absolutely we'll do that and are supported to do that if necessary.
From WATE, is there a maximum limit to the scope of contact tracing?
Oh, that one's a tough one. So we will continue to contain and mitigate, is what we call that, as long as we can. And so we feel very confident and comfortable with the amount that we are able to scale up our operation. Not only would we be able to do that with staff members here from Knox County Health Department, but other county resources. We've had the states actually getting some additional resources, the Tennessee Department of Health, to help with contact tracing across the state that we could utilize. We've had other partners that have great skills and resources that have offered up support to us as well. So I feel like that this can move forward, and it's really hard without knowing firm numbers of what's needed to give a hard answer on that. But I feel really good about the amount of resources and support that we have moving forward.
Any other questions? Okay, if there's no other questions, we'll go ahead and log off. Thank you all for joining us, and we will see you tomorrow at 12:30.